when we thought about introducing our model, we were very aware of the fact that a school culture is going to matter. What that school culture is like is going to matter to how easy it's going to be to embed an occupational therapist in there. We thought about the culture of the health agencies who fund the service and how that might interface with the school. What we didn't really think about was our culture as academics and how that influences how we interact with organizations that are out there in the community. And one of the things is that when we were studying the implementation process, and we did that through qualitative interviews and focus groups, and part of what we wanted to identify were what worked, where are the successes, what's going well, but we wanted to identify what's not going well, what did we not do right, where were the barriers, what went wrong. And as researchers, we thought, well, that's great. That's exactly what we want to know. And you learn as much from what didn't go well or where the barriers are as you do from the successes. When we started to share that with our partners, we didn't realize right away that because they're an organization and that doing this is their job, that sharing things that didn't go well can actually impact how their job performance is evaluated. So if this turned out, if problem X was identified that could be a barrier, our perspective was, oh, well, that's great, we learned about this, isn't that wonderful? But from their perspective, it's like, that could really impact that person because that's a part of that person's job. So one of the things we learned to do is to kind of think about how we could share everything we learned and be completely honest about what the data show, but do it in a way that isn't hurtful to our partners. And the strategy we came up with was being solution-focused and to have action-oriented objectives. So now when we communicate, before we put anything in a formal report or document that's going to go out and be used by people in management, by people being even at higher levels of government, because you send these things out and they work their way up through the system, is that we talk to our partners, we meet with them, and we say, okay, here was the barrier. What are we going to do about it? Let's implement a solution. Let's come up with our action plan, and let's actually work through it first. So then when we share that, we've now presented it as, yes, there was a barrier, we can document it, but we also have said, and we found a solution, so then it works for both, and it moves our project forward because now we've fixed the problem. So that was something that, again, as a team, was completely unexpected the first time that we had that, where we went, oh, that's really important to understand, and we need to find a way to communicate in a way that works for everyone.